Hi, my name is Dr. Barry Sloan. I'm a family practice osteopathic physician in New York City. I see low back patients all the time. One of the concerns that I notice among my low back pain patients is that they have a lot of difficulty talking to doctors about a sensitive issue of their life, and that's how romance is affected by their low back pain. Somebody with chronic low back pain affects many areas of life, but one special area that doctors find difficult to talk to patients about and patients find difficult to talk to doctors about is the effect the low back pain has on their romance life. It could be all of a sudden after injury, or it's something that can be gradual just from chronic wear and tear and people who have physically demanding jobs. Because of the difficulty that, like we said, doctors have discussing this with patients and patients have discussing with doctors, I decided to write a book together with some experts in the field to help give patients some guidance on this issue. This book will highlight and elaborate on some things that could be very helpful to patients. One will address some basics, so the biomechanics of the spine. We'll go into the anatomy, the physiology, why people have back pain, different kinds of back pain, and how the nervous system is related to back pain. The other thing that we'll focus on in this book is a lot of the work that was done interviewing patients with low back pain. Extensive interviews were done with 30 patients who have chronic low back pain and romance issues. There's a lot of work that's done that will be invaluable to a patient who has romance and low back pain issues based on these interviews. The interviews and the results of these interviews can help a back pain patient immensely in eliminating a lot of the guesswork, like which positions might work, which positions might not work, and which positions can be harmful and painful. Having this advice and advice is something that will be helpful to you, the reader. Other things that will be helpful are exercises that are highlighted in the book specifically for patients with low back pain and romance issues. Also, what we're going to talk about is medications, which medications work and which medications won't, and which medications may have problems in terms that may help the back, but may be a problem in terms of having a romantic life. Other things we'll discuss we'll touch on things like injections, specifically epidural injections, as well as other injections that may help on the back. We'll also discuss a little bit about different surgical approaches to help the low back. So in summary, the issue of low back pain and romance is something that's a sorely neglected topic among the dialogue between doctors and patients. This book addresses that through the things I've mentioned, the results of interviews conducted among 30 patients, exercises which we're going to go over, discussing the effects of various medications, as well as discussing about injections and surgical options. These will all be very helpful to the patient, both man and woman, who are suffering from low back pain and its concern on and effect on somebody's romantic life. Thank you very much.